Okay, let's unpack this a bit. Have you ever wondered, how much our partners actually mirror us, especially in ways we might not even realize?
Hmm, it's a fascinating question, isn't it?
Yeah, and we're diving deep today into some pretty compelling research on that exact topic. It's a huge new study published in Nature.
Ah, you must mean the Mohana Basu article. Spouses tend to share psychiatric disorders. Massive study finds.
That's the one, August 29, 2025. And our mission really is to explore this, well, surprising finding that people with psychiatric disorders seem more likely to marry someone with the same condition.
Right.
And then we really want to dig into the theories about why that might be happening.
It's truly significant research. We've seen hints of this before, maybe in studies from, say, the Nordic countries. But this one,
This one's different.
oh yeah, the sheer scale, the cultural breadth, Taiwan, Denmark, and Sweden, it gives us really solid evidence for a pattern we're just starting to properly understand.
Okay, so let's talk scale. How big are we talking?
Well, the study looked at data from nearly 15 million people.
Wow, 15 million. That's incredible.
It is. And they specifically examined 9 psychiatric disorders, things like schizophrenia, bipolar disorder, depression, anxiety, ADHD.
Autism, OCD, substance use disorder, and anorexia nervosa, too. Right?
Exactly. Those 9.
So what was the kind of core finding from looking at all these people and conditions?
The main takeaway is pretty stark. If one partner had one of these conditions, the odds went up significantly that the other partner would also be diagnosed with any psychiatric condition, actually.
Okay, so a general increase in likelihood.
Yes, but here's the really interesting part. The chances were even higher that the partner would have the same specific condition.
The exact same one, not just any condition.
Precisely. That mirroring effect was stronger for the same disorder. And this held up, across all 3 countries, different cultures, different healthcare systems,
And even across time.
and across generations, yeah. Which is striking when you think about how much psychiatric diagnosis and treatment has changed over the decades.
That consistency really is something. Did the study mention any trends over time? Did this pattern change at all?
It did, actually. They looked at birth cohorts, basically groups of people born in certain decades from the 1930s up to the 1990s.
Yeah.
For most conditions, the likelihood of partners sharing a diagnosis actually increased slightly decade by decade.
It increased, even with more awareness or changing social norms.
Seems so. Particularly for disorders related to substance use, that trend was quite noticeable.
Were there exceptions?
A few, yeah. Things like OCD, bipolar disorder, anorexia nervosa. They showed slightly different patterns depending on the country. Shared OCD was more common in Taiwanese couples than in Nordic ones.
Okay, so it's mostly consistent, but with some nuances, which I guess brings us to the big question. Why? Why is this happening?
Right. The study doesn't give definitive answers, but the co-author, Chen Fan, talks about 3 main theories.
Let's hear them.
Okay, first is assortative mating. It's basically the idea that, well, people are drawn to others who are similar to them.
Like attracts like.
Kind of. Maybe it's about shared experiences, even shared suffering, as Fan puts it. A sort of mutual understanding that creates a bond.
Makes sense. What's number 2?
Second is convergence. This suggests that sharing the same environment, the same home, same daily stresses, same coping strategies, maybe makes partners become more similar over time.
So the relationship itself could influence mental health.
Potentially, yes. And the third theory is about societal stigma.
How does that fit in?
Well, the reality is, having a psychiatric disorder might unfortunately limit a person's social circle or dating pool. Stigma could subtly push people towards partners who might have similar experiences or face similar societal biases.
So attraction, shared life, and societal pressures. A complex mix.
Definitely. And there's another layer, too. Psychiatric geneticist Jan Fullerton added an interesting point.
Oh, yeah.
She suggested that the stress within a relationship itself could potentially trigger or worsen a condition in a partner, especially if they maybe had some milder or undiagnosed symptoms to begin with.
Wow, so the relationship environment isn't just passive. It could be an active factor in diagnosis.
That's the implication. It really makes you think about how deeply our relationships and our mental health are intertwined, not just reflecting each other, but actively shaping each other.
So wrapping this up, what's the key thing for you, the listener, to take away from this deep dive?
I think the main point is this clear global pattern. Spouses do tend to share psychiatric disorders, often the very same one.
Right. And it's likely driven by a mix of factors: who we're drawn to, how our shared lives affect us, and maybe even societal forces we don't always see.
Exactly. It's
It
complex.
really makes you pause and think, doesn't it?
It absolutely does. This research reminds us just how much the choices we make about partners and the environments we build together can echo through our mental well-being.
A final thought to leave people with.
Maybe just this.
Yeah.
Consider how the people closest to you influence your world, and perhaps how that understanding changes the way we think about supporting each other's mental health journeys. It's all connected.